All right, so this video is kind of like an expansion on the one that I did yesterday. And what I did is I basically used AI and then I put in questions and then I had it kind of go down and give me the answers in a way that it's going to be able to paint a picture in a little bit easier of an understandable light. The one reason I kind of like AI in this particular factor is because you're not getting just one person's opinion on one side versus another person's opinion on another side. I really don't like narratives, and I really don't like taking. Again, well, I can appreciate like psychology and psychiatry. Those are mainly perceptions. I'm more or less focused on the actual evidence of mental illness and what happens to the body when it comes to hormone dysregulation, when it comes to what you're eating, what you're drinking, what you're putting into your actual body, and what kind of effects that could potentially cause. Obviously, I'm not a doctor. If you have issues kind of going on, you're going to want to speak to a physician. But in there's not there are a lot of people out there who don't have the actual full picture of kind of what's going on, and they just basically hear the narrative and then they take off with it. So I'm kind of putting this out there so that way people can understand just a little bit better on what can potentially occur to you if you're having like hormonal dysregulation or whatever else. So I'm just going to start with I'm going to read off my questions and then I'm just going to give you the answer. And you can come up with your own conclusions. If you're having issues of your own, obviously go speak to a physician. But when you have correct information, you can kind of learn to pinpoint what's going on with yourself if you're starting to feel dysregulated. If you understand what I mean. So serotonin and dopamine can cause hallucinations, right? And it says, yes, dysregulation of both serotonin and dopamine is strongly linked to hallucinations, though the relationship is more specific than simply they cause them. I'm not going to read all of this because there's so much more below that. And it says, important nuances. It's not that normal levels of these neurotransmitters simply cause hallucinations. It's usually excess signaling, receptor overstimulation, or imbalance relative to other systems, including glutamate and others. Not every change in serotonin or dopamine produces hallucinations. Context, brain region, receptor subtype, and individual factors matters a lot. Other symptoms, especially glutamate and MDA, are also heavily implicated in psychotic symptoms. So the short version is yes, both serotonin and dopamine play major roles in the biology of hallucinations, mainly when their signaling is excessive or dysregulated in specific pathways. So when people talk about, well, you're having hallucination, I'm asking what's actually causing it. Now I asked whether or not that, auditory, it can actually cause like dopamine and serotonin levels, if they fluctuate, can it cause like actual auditory hallucinations? And it says, yes, both systems are strongly linked to auditory hallucinations as well. Dopamine excess is particularly associated with the classic auditory hallucinations of schizophrenia and related psychosis. Hearing voices, commentary commands, etc. This is one of the most characteristic positive symptoms that dopamine blocking antipsychotics targets. And I'm actually going to go into that one. Serotonin, especially 5-HT2A receptor overstimulation, more commonly produces vivid visual hallucinations. But it can also contribute to auditory and other sensory hallucinations. And serotonin dysregulation is involved in the broader picture of psychotic symptoms that include hearing things. So the link holds for both auditory and visual. And then I asked, in people with mental illnesses, while genetics and neurotransmitters play a role, these hormones affect how the brain work, which means that if their hormones are affected, even cortisol, it can actually cause hallucinations, correct? And it says, yes, with some important precision. Serotonin and dopamine are neurotransmitters, chemical messengers between brain cells. Cortisol is a hormone released by the adrenal glands. People often lump them together under chemicals that affect the brain, which is fine for everyday discussion, but they work differently. Hormones, including cortisol, clearly influence brain function and can interact with neurotransmitter systems. And people who already have a vulnerability, like a genetic predisposition, existing mental illness such as schizophrenia, bipolar, severe depression, significant hormonal disruption can worsen symptoms, or in some cases even trigger psychotic features, including hallucinations. So, and this is my opinion, I think it's a little bit more hormonal than just necessarily just actual brain structure, and I will also go into that. And that's not my opinion. Cortisol specifically, chronically or elevated cortisol, is linked to changes in brain regions, including perception and reality testing. It can dysregulate dopamine and glutamate systems, lower the threshold for psychotic symptoms, and make existing hallucinations worse or more likely to appear. Acute extreme stress or sudden large cortisol spikes can also contribute to brief psychotic episodes in susceptible people. So the bottom line, in people with mental illnesses, the picture is almost always multifactorial: genetics and neurotransmitter dysregulation, hormonal influences, including cortisol, environment, stress, all interact. So yes, when hormones are significantly off, they can affect how the brain works and help produce or intensify hallucinations. The effect is real, but it usually works with the other factors rather than completely independently of them. And I asked, how often is it simply the brain structure itself, and how much is due to just neurotransmitters misfiring? It says, it's almost never simply one or the other. In people with mental illnesses that involve hallucinations, brain structure and neurotransmitter systems are tightly linked and usually both involved. So the brain structure, reduced gray matter volume in areas involved in perception and reality testing, like the auditory cortex, superior temporal gyrus, hippocampus, and prefrontal cortex, enlarged ventricles, altered white matter connectivity. These differences often appear early, sometimes even before full onset, and are thought to create a vulnerability. Structural changes can make the brain more prone to generating false perceptions or failing to correctly filter internal thoughts from external reality. And neurotransmitter dysregulation, misfiring. This is also central. Dopamine hyperactivity in certain pathways is strongly tied to the experience of hallucinations, especially auditory ones. Serotonin, glutamate, and other systems also play roles. Even when the structure looks relatively normal on a scan, chemical imbalances can still produce hallucinations. And it says how they interact. In most cases, it's not an either or. Early development or genetic factors can produce both structural differences and lasting changes in neurotransmitter systems. And it says the rough practical takeaway. I'm not going to read every single thing because it would just take forever. In schizophrenia and related illnesses, both factors are usually present to some degree. Structure often sets the stage, the vulnerability, while neurotransmitter dysregulation more directly drives the active symptoms like hallucinations. The exact balance varies between individuals and is still an active area of research. And I asked, can you control the neuronal misfiring by altering hormone levels? And obviously this is going to change per person, per brain structure, what they're eating, what they're drinking. Like, there's just so many different factors that you can't just pick one. So it said partially yes, or you can't focus on just one. Partially yes, but with important limits. Hormones can influence the neuronal activity and neurotransmitter systems. So changing hormone levels can reduce or worsen misfiring in some situations. However, it is rarely a complete or primary way to control it, especially in primary psychiatric conditions like schizophrenia. How hormones can affect neuronal firing. Cortisol. High levels can increase dopamine release in certain brain areas and disrupt glutamate signaling, lowering chronic high cortisol. Better stress management sleep can reduce the intensity of some of these symptoms. Sex hormones. Estrogen in particular has modulating effects on dopamine and serotonin systems. Some research shows that higher estrogen phases or estrogen supplementation can reduce symptom severity, including hallucinations, in certain women with schizophrenia. The reverse, low estrogen, can make symptoms worse. Thyroid hormones, both hyper and hypothyroidism, can trigger or worsen psychotic symptoms. Correcting the thyroid imbalance often improves or resolves the hallucinations when the thyroid problem is the main driver. Other hormones like insulin growth hormone have more indirect effects. And it says the realistic picture. Psychosis caused mainly by an endocrine disorder like Cushing's, severe thyroid disease. How much hormonal change helps, often substantially. Treating the hormone problem can markedly reduce or stop the hallucinations. Classic schizophrenia, bipolar psychosis, modest at best. Hormones modulate the system, but usually they do not fully control the core dopamine-driven misfiring. Stress-triggered worsening of existing illnesses. Noticeable benefit from lowering cortisol stress load. In most cases of mental illness involving hallucinations, the primary treatments still target the neurotransmitter systems, mainly dopamine D2 blockade with antipsychotics. Don't get me started on those. Hormonal approaches are usually secondary or supportive because they make money. Bottom line, altering hormone levels can influence and sometimes reduce neuronal dysregulation, but it's not a reliable standalone way to control the misfiring for most people. The effect is real, variable between individuals, and strongest well when a clear hormonal imbalance is present. And then I asked, obviously, can adding medications actually worsen the effects? Because I think we're all kind of wondering how much of the polypharmacy or the medications that we are consistently given are actually causing or triggering some of these effects. I know I am, or I have. Actually, the more I've gotten away from any types of medications, the better I've gotten. And all I ever did was like change my diet, my exercise. That's literally it. It says, yes, adding medications can sometimes worsen hallucinations or other psychotic symptoms. Medications that can directly trigger or intensify hallucinations. So corticosteroids, well known for causing steroid-induced psychosis, including vivid hallucinations in some people. Stimulants, amphetamine-based ADHD meds, high-dose caffeine, dopamine agonists can actually cause or worsen hallucinations by increasing dopamine activity. Certain antidepressants, especially if given alone in someone with bipolar vulnerability, can push someone into mania or psychosis. Some anticholinergic, there we go. High-dose amphetamines or other medications that can disrupt normal brain signaling. Antipsychotics are the main treatment for hallucinations, but in a minority of cases, they can cause paradoxical worsening, severe restlessness. Adding multiple psychiatric medications increases the chances of interactions over sedation, cognitive dulling, or paradoxical effects that may make symptoms feel worse. How in the actual frick would you be able to tell what's going on if you're basically dulling their systems? How does that make any sense? Wouldn't the smartest idea would be to go to like a neurologist and then just have them kind of check how like your brain is actually firing, so that way they can pinpoint the area in the brain that actually needs to be taken care of, because they can literally track that backwards. Like if it's like firing in this particular part of the brain, you know what I mean? If they can track that down and be like, hey, in the thalamus, over here, is that the right word? I can't think right now. My brain's not functioning. But like it's over here in this part of the brain. It's right there, track it back to this area, this area, this area, this area, and then they can like literally pinpoint it, and they can kind of help the actual neuronal firing in that particular area. I mean, obviously it's more than likely going to have an after effect, because everything always does. If it's genetic, you're not going to actually fix that if it's like a genetic thing, in my opinion. Again, I'm not a doctor, but that doesn't make any sense. Medications are double-edged. The right ones at the right dose can reduce neuronal dysregulation and hallucinations. The wrong ones, wrong dose, or wrong combinations can amplify the problem, sometimes dramatically. This is why changes are best done carefully and monitored, especially in people who already have a history of psychosis or high sensitivity to chemical shifts in the brain. Do you realize that they're timing doctors to the point where they're literally in there and they're just like, okay, well, you got to get into the next person? And then you kind of get transferred between like 45 different departments. Okay, not that many, but it's quite a few. Because you're not seeing just one doctor, you're going from one specialist to the other specialist to the other specialist to the other specialist. And then during that whole thing where you're going to all these different specialists, and then they're sending you a psychiatrist, and then they're sending you to this person, and then they're sending you to this person. How in the actual fuck are you going to be able to actually take care of a human if they're seeing all of that many people and they already have like just horrible caseloads? No wonder people are falling between the cracks. Can a bad diet, chemicals in food or drink worsen the effects? Yes, a poor diet, including certain chemicals or substances in food and drinks, can worsen hallucinations and overall symptom intensity in people who are already vulnerable. Blood sugar swings, inflammation in the gut to brain axis, highly processed foods, excess sugar, industrial seed oils, and some additives promote systemic inflammation. Chronic inflammation can affect neurotransmitter systems and brain function and is linked to worse outcomes in schizophrenia, spectrum, and mood disorders. I keep telling you everything goes back to inflammation. I keep telling you that. Caffeine, alcohol, disrupts multiple neurotransmitter systems and frequently worsens psychotic symptoms during or after use. Artificial additives. Evidence is stronger for behavioral effects in some people than for full hallucinations, but a subset of sensitive individuals report clear worsening. Excess ultra-processed foods overall associated with poorer mental health outcomes in observational research. Nutrient shortfalls. So it says the realistic scale of this effect. Diet is rarely the root cause of true psychotic hallucinations the way core neurotransmitter dysregulation or structural vulnerability is. However, it is a meaningful modulator. In someone already dealing with mental illness, a consistently bad diet can lower the threshold for symptoms, making existing hallucinations more frequent or intense, and reduce the effectiveness of other treatments. Conversely, stabilizing blood sugar, reducing inflammatory load, and correcting major deficiencies often produces noticeable calming effects for many people. So yes, chemicals and overall quality of food and drink can and do worsen the effects in a measurable way for a significant number of people. And then I also asked, can location, not race, and sound waves or environmental factors change this as well? Because you have 20,000 different epigenetics, that's going to change like depending on whatever location that you're in, which means that you're going to have effects from that. And it says, yes, location and environmental factors, including sound, can influence the intensity and frequency of hallucinations and related symptoms in vulnerable people. Urban versus rural environments. One of the most consistent findings in schizophrenia research is higher rates of psychosis in cities. Sound. Factors tied to location include greater social stress, population density, reduced access to nature. Higher rates of certain pollutants and more chronic low-level stressors. Moving from a high-stress urban setting to a quieter rural one sometimes reduces symptom severity for some individuals. Air quality and pollution. Climate, altitude, and sunlight patterns. These affect sleep, vitamin D status, circadian rhythms, and stress hormone levels. This is why I don't like cities, because they're shitholes. Local toxin exposure. Then I'm going to go to sound waves and auditory environment. Chronic noise pollution, continuous traffic, industrial or urban noise elevates cortisol and keeps the nervous system in a higher arousal state. This can lower the threshold for psychotic symptoms and make existing auditory hallucinations harder to manage. You're just basically listening just nonstop. So your brain is basically sitting there revving, like all of the time. And it says these factors are almost always modulators rather than primary causes. They rarely create hallucinations from scratch in someone without vulnerability, but they can meaningfully increase frequency, intensity, or distress when the underlying neurotransmitter, hormonal, or structural factors are already present. So you kind of have to imagine yourself in like whatever situation that you're in. You know, these factors are going to be present at some point in time. If you're dealing with like mental illness, or they're trying to label you as like mentally ill, like you ask yourself about what your stressors are first. And then it says, and then I asked, can pregnancy and breastfeeding alter those effects? And it says, yes, pregnancy and breastfeeding can significantly alter the intensity and pattern of those effects. And during pregnancy, there's major hormonal shifts, especially large rises in estrogen and progesterone. And in many women with schizophrenia I'm not going to read that. I'm going to try and keep it a little bit shorter. Pregnancy and breastfeeding can produce some of the largest natural hormone swings a person can experience. These swings can either dampen or amplify neuronal dysregulation and hallucinations, depending on the individual, the phase, and other factors like medication changes, sleep, stress. The effects are real and clinically recognized, which is why psychiatric monitoring is often increased around these periods. Why? You already have the actual evidence in front of you. A psychiatrist is just basically somebody on the actual outside staring at the actual after effects. This is the evidence. These are the effects. Somebody basically from the outside trying to explain what's going on in somebody else's head, that doesn't make any sense whatsoever. You should actually be focusing on the actual neurology of it, like the actual brain itself. Rather than having a psychiatrist or psychologist come in and say, hey, this is kind of what we think we see, this is our perception, this is what our books taught us, and that it doesn't make any sense. Again, while I can appreciate, what they're seeing, I what are we doing here? And then I also asked, can changes in hormones, especially due to age, also contribute to dementia and the increase in symptoms? And it says, yes, age-related hormone changes can contribute both to the development or progression of dementia and to an increase in neuropsychiatric symptoms, including hallucinations or worsening of the existing ones. Estrogen decline. Estrogen has neuroprotective effects on the brain, reduces inflammation, influences acetylcholine and other symptoms. The sharp drop at menopause is associated in multiple studies with accelerated cognitive changes and higher risk of Alzheimer's disease in some women. It can also lower the threshold for mood, anxiety, and perceptual disturbances. Testosterone. Gradual drop with age is linked to reduced cognitive performance, lower brain volume in certain regions, and increased risk of cognitive impairment in some research. And then I asked, what does too much or too little hormone levels do to the brain itself? And what are the effects, and how does the gut to brain axis play a role? So I'm not going to read the whole thing. I'm going to go to the very bottom because it gives a summary. Hormone levels that are too high or too low change brain volume, connectivity, inflammation, and chemical signaling. The most common results are problems with memory, mood regulation, stress sensitivity, sleep, and in people who already have vulnerability, increased risk or intensity of psychotic symptoms. The gut-to-brain axis acts as both a sensor and an amplifier in the system. Hormone problems disrupt the gut, and gut problems feed inflammatory and chemical signals back to the brain, creating a two-way loop. So that's pretty much the kind of like a clearer picture. It's always been my main question regarding the whole mental illness things. It's not, oh my God, you're crazy. It's more like what's going on with your actual physical structure that's actually causing it. And that's more of a medical thing that I think we really need to be more focused on that versus all of the other things kind of surrounding it, because when you get all of these additional kind of people on the outskirts trying to explain the actual evidence that you're seeing, and that those people are taking their perceptions and then they're throwing it on top of what actual doctors are seeing, we don't need that portion. Like, I can appreciate it from over here, but like it needs like some cutoff point. You shouldn't be inserting your opinion onto the actual evidence, in my personal opinion. But that is it for today, and I hope y'all have a good day.